Because motherhood's a lot. This is Hot Mess Mums with Magpie, helping you find your balance in the chaos. Dr. Holly Cardin, welcome to the Hot Mess Mums Club podcast. So good to have you here in the studio as well. For our amazing listeners, tell us a little bit about your role and what you do.
Okay. Well, first of all, can I just say thank you for having me? It's an absolute pleasure to come and speak to you. But I'm a Newson health clinician. So I've worked for Newson Clinics for about 3 years now, looking after women and their hormone health. And then I also work as education lead for Newson Education. And Newson Education is Louise Newson, who's my boss. It's her brand of education for healthcare practitioners. So it's all evidence-based. We are not influenced by pharma, and we want to sort of help the healthcare practitioners out there to really understand women's hormone health, and we want to do that on a global level, so it's quite adventurous.
We're loving it though, because it's such, thankfully a big topic now. We are talking about it, know, and we know that there is that gap for women of they're going through it, but they're not being diagnosed. There's some kind of misunderstanding. We're seeing that at the moment on TV. EastEnders have taken up this very powerful
I saw that
storyline, which is, getting a lot of positivity from people, because I think it's such an issue, isn't it?
Yeah.
So it's fantastic to think that you want to bring that education to everybody, which in turn would make it easier.
Then improve the care. I mean, I think EastEnders were really brave to bring up that storyline. Unfortunately, it isn't a uncommon presentation to our clinic. So we are a private clinic, and we see a lot of women who do try and access care through the NHS but are not able to. And those themes of not being heard, not being listened to, not being treated appropriately, misdiagnosed, inappropriate prescribing are quite common things that I hear in clinic on a daily basis. So it's a sad fact, but it's very true, and something that I see all of the time.
I mean, it's obviously an issue with training, and we hear everything from, women being offered sleeping pills, the contraceptive pill, antidepressants. It's happened to me several times when I've been offered antidepressants and sleeping pills in one go. I don't know how I'd function. I've got 2 children, and I was just like, I don't think that's for me. But for many women, I think when it starts to change, when things start to feel off, you do start to feel crazy. Definitely there is an element of that where you start second guessing yourself, especially when you've got brain fog. And this happens to me all the time, where I have a word and I cannot think what I'm going to say, and it just disappears. So I think when you then go, you put yourself out, you sit in front of someone and say, this is where I'm at, and I think it's my hormones, and they dismiss that. I mean, it has been described as medical gaslighting by quite a lot of people. It can have a huge effect on a woman, though, afterwards, can't it?
Absolutely. I mean, when you're suffering and you're struggling to advocate for yourself, to come up against a brick wall is sometimes too much for some women. And there are those that are able to, it sounds like you did yourself, push through and continue to advocate. And, the population of women who come to see us at Newson Clinic, they are very privileged in that they're able to afford that care, but not everybody is able to. But what we do is we use the profits from the clinic to try and improve the education. So whether that be patient education or education for healthcare practitioners as well. So, and Louise has just done masses and masses of education, to the point where now the patients are a bit ahead of the curve compared to the doctors. And she'll continue with that mission. But it just means that then, women who aren't able to come to our clinic, they still are able to access some information, some education, get to understand what's going on with their bodies, and then they're able to go and advocate for themselves a little bit better when they see their healthcare practitioner. It might be a good idea to kind of go back to basics a little bit and just explain a little bit about what hormones are, do a bit of a biology lesson.
Yes.
Because I know when I was at school, and I went to an all-girls school, so all of my, I think we talked about this on the call, didn't we? All of my teachers were menopausal, all of our mums were menopausal, but we didn't have any education around hormone health, let alone about menopause. So I think to be able to understand what hormones are and then be able to use that information to understand your symptoms is quite good, like basic foundation to have.
Yeah, absolutely. I mean, for a lot of women, it starts in their 30s, but we don't recognise it.
Yeah.
You know, we think it's other things.
Yeah.
I mean, it's huge, isn't it? And if you don't have any education over it, we haven't been told. I wasn't at school either. And we were saying earlier, you know, it wasn't talked about by my gran.
No,
you know,
no.
We don't talk about things like that. So we are breaking that sort of, and thank goodness.
Generational change is happening. But, you know, hormones are just little chemical messengers, and they whiz around your body and they tell all of your cells what to do. And your sex hormones are progesterone and estrogen and testosterone. And that language of sex hormones has very much pigeonholed them into being then, when they're viewed in medicine as like bikini medicine, you know, breasts and vaginas and periods. But actually, they do so much more in your body that, and are involved in every single organ system in your body, that it's very, we have to move away from that idea that it is just about periods, it is just stopping or changing. It's about hot flushes, when there are lots of other symptoms and also other impacts on our body and our long-term health when we have hormone changes or hormone deficiencies. And, you know, when we touched on mental health, but the progesterone, estrogen and testosterone, they're not acting distantly, they're acting on your brain. They modulate the neurotransmitters in your brain. So things we do tend to recognise as being related to your mental health. So, you know, serotonin and dopamine as well. And there are some schools of thought that actually would say that the sex hormones are neurotransmitters in themselves. And when they change, they fluctuate, when the brain can't adapt to them, when you become deficient in them, that's when you will develop symptoms, especially mental health symptoms are the most common symptoms that I will see in clinic. The ones that we recognise in terms of the vasomotor symptoms, which are the hot flushes and the night sweats, actually when we look at the research that we've done at Newson Clinic through like the Balance app, you know, they're way down the list in terms of how common they are brought up by patients, how severe those actual symptoms are. And it's much more common that you will see mood changes, brain fog, like you mentioned, cognitive function problems, and like anxiety symptoms.
Yeah, anxiety is huge. You know, I mean, oh my God, I've had meltdowns in my car when I'm going shopping. I've had a meltdown in a shopping centre. And at the time, you know, I couldn't work out what it was. And I just thought, I'm a terrible mum. I'm being nasty to the kids. You know, I'm sweating. I can't be here. There's too many people. Yeah. And then I look on the calendar and I think, oh God, yeah, I know exactly why this is happening. And it is debilitating. That mental health that you mention, you know, we hear a lot about you have to look after yourself. What you eat is so important. How you move is so important. How you sleep is so important. Yeah. So for me, I always thought, I'm just going to do it naturally for as long as I can, you know. But I think it gets to a point where you have to accept that you can be doing everything and it can still be terribly hard. Yeah. And when that cloud comes and you feel like you go to a very dark place, and I know I've had that, I know lots of women do, that is a very difficult place to be then, I think. And getting out of that it's sometimes you just think, wow, what's happening to me, you know?
Yeah. I mean, there's 2 points that I just want to pick up on there. Number one, about lifestyle, and then secondly, talking about those dark thoughts that you've mentioned, which I think don't get flagged enough. With lifestyle interventions, and there is this movement where menopause is seen as a natural process, and therefore, you know, it shouldn't be medicalised. And there's a great speaker and integrative gynecologist, Dr. Felice Gersh, who says, well, you know, hurricanes are natural things as well, but it doesn't mean that we don't prepare for them. And that, I think it's a great analogy, because we don't have to just say one, you know, we choose one treatment path or another. You don't have to just eat well, exercise more, think of your microbiome, reduce your stress, focus on your sleep. Those things are absolutely vitally important, but why can't we do that alongside also replacing your hormones? Because hormones, the sex hormones, are just hormones like insulin is a hormone that's deficient in diabetics or resistant in diabetics. Thyroid hormones are just hormones which are deficient in people who have hypothyroidism, and we wouldn't say to those groups of patients, just, you know, stop drinking alcohol, cut down on your smoking, lose some weight. We would give that advice, but we'd also replace their hormones at the same time. And then the second point that you bring up about those dark thoughts, unfortunately 1 in 6 women who come to our clinic have thoughts of harming themselves, not wanting to be here, or actually wanting to commit suicide. And that is a really stark fact that I didn't even know as a doctor until I started working at the Newson Clinic. And we give a menopause symptom questionnaire, or a hormone symptom questionnaire now we call it, before the patient comes in for a consultation. And the amount of women who tick yes on that box shocked me, because I've never asked that question before in a consultation. And now it's just a routine part of my consultation that I will ask about those thoughts. And the vast majority of women have no plans to do anything to themselves, but those thoughts are still extremely distressing for them. But they've got such amazing insight into the fact that they feel that way, and that this is not how they normally will feel. And there's, I think about 40% of women will be diagnosed with depression over the age of 45. And these are women who've never had a mental health problem before, who suddenly get diagnosed with depression, who get put on antidepressants. And actually, what's more likely to be happening is there's changes in the hormones that are causing these endocrine depression. And Newson did some research recently that showed that there was a 92% improvement in those types of thoughts if you optimised HRT and included testosterone as well. So I don't think we need to be reaching for antidepressants and sleeping pills as first line. We need to be recognising the symptoms. You know, as clinicians, we need to learn to recognise those symptoms. Patients need to be educated so that they're able to recognise those symptoms. But when they do come into clinic, they're taken seriously. And then I think it's much more likely that we'll be able to improve people's mental health and their function, their quality of life, their relationships. It's got like a ripple effect, you know, work.
Everything. And let's, you know, touch on that, because it can really harm a relationship, you know, because that person in your life, might be taking it out on them when you're very angry. You know, they are also coping and trying to understand what they can do for you and how to help you, your children, and absolutely your work, because I don't think in the corporate world, or in many jobs, to be honest, there is an understanding. You know, I had this conversation recently because I had a really important meeting, and I looked on the calendar and it was at my time, and I thought, I don't want this meeting when I'm going to be on my period, and I just know it's not a good thing to have. So I might actually say to them, you know, I can't do this because... And then someone said to me, But you can't do that because, you know,
why not?
They won't. What are you going to do when you're working for them? What are you going to, because they'll be like, oh, this person's going to, you know, they need you. So how do you, and I think a lot, you know, it's a very valid point. A lot of women feel like that. You can't say, actually, I'm not having that meeting with you today because this is, people just look at you gone out.
Yeah. Especially if you're in a very like male dominated like employment, then it's a tricky conversation to have.
Well, see, I'm a radio presenter, so you can't take time off. You can't say, I'm not coming to do my show today because, you know, you just can't do it. Yeah. So what do we do? And there's lots of other women that would probably have, you know, that feeling because we don't have there's not enough support and education in our work life either. It can affect everything, can't it? You hear of women quitting their jobs.
Absolutely.
You know, walking out of their homes.
Yeah.
I mean, it can really rip everything up. I know people say it can be an awakening for a new path, and I believe that too.
Yeah.
But I think it can have devastating effects. Also, can't it?
Yeah, I mean, the research is there that women are more likely to take time off work, they're more likely to go part-time, they're less likely to go for promotion, they're sadly more likely to be sacked from their job.
Yeah.
And these are women of high levels of responsibility, lots of talent. These are women you want to keep in the workplace, and we're losing them. And then that impacts them, you know, financially, as well as having that social system in place. And then there becomes this kind of gap when it comes to pensions and things.
We become small, don't we? We shrink ourselves in a way because we step away from everything that we're doing and also the chance to do more because you don't feel like you can, I think.
And when you said, well, what do we do? I agree. I think sort of scheduling things as best you can is important, but often women, when they get to perimenopause, if their cycle has become irregular, that's very hard to do.
Yeah.
So I think the best thing to do would be about just making sure that you get your hormones optimized so that you don't feel like that in the first place. And then you said about relationships. There's just massive impacts on partners, on marriages breaking down, on sexual relationships as well, in terms of sort of physical, psychological.
It does affect intimacy, doesn't it?
Exactly. And you know, sexual health is a big part of your well-being. It's something that I'm actually quite interested in. But if we don't address any of this, and we're very British and we don't like talking
don't
about
like to say the word sex or anything like
things.
that. Yeah,
it's actually harming our patients because we don't talk about it. We're never going to help. We're never going to make any difference. So it just brings us right back to education, information for patients, education for the clinicians, and just making sure that you get the right care as well.
Let's talk about misinformation. I know it's something you're quite passionate about as well. There is a lot of that on social media. A lot of people calling themselves experts, you know, sign up for my 3-month plan. I'll tell you what to eat if you're perimenopausal and all of that. And there are women that are desperate and perhaps can't afford private, but can afford that. How dangerous is it? And what would your advice be to women out there when it comes to these sort of platforms that are everywhere?
I think just be aware of there's an algorithm out there serving you this information. If you're of a certain age, a gender, you know, you've searched for things online, you are going to get served this type of information. And I think it's about making sure that you access information that has been created by somebody who has expertise, and that information is all evidence-based as much as it can be. And there's going to be an element of expert opinion, but you want to have that from somebody who's seeing hundreds of menopausal women or women with hormone health issues a month. And if you want to access free evidence-based information for patients, then I'd use something like the Balance app, which Louise, our founder, created. And, I think there's two areas where you can use it. Number one is symptom tracking. So you can track your symptoms on there. It might help you to understand what kind of hormone health issue you have. You can then print that information out, or you can show that information to your healthcare practitioner on the app. So it's there in black and white rather than you having to be subjective and describe things. And then the other side of the Balance app is information. Lots and lots of information on every single type of topic that you could possibly think of when it comes to female hormone health. And it's easily searchable, and it's available in a few different languages now as well. And that's all completely free. And it's not like some of the symptom tracking apps where they're taking your data specifically so that they can sell you things. It's literally there for information.
We spend so much time thinking about how we look and not nearly enough time thinking about how we feel in our bodies, in our skin. Today's episode is a reminder that both matter. Magpie was created for exactly that reason. It's skincare, yes, but it's also a ritual, a moment where you choose yourself. The shower gel is your daily reset. The bath salts are your Sunday exhale. And the new body moisturiser coming very soon is the finishing touch your skin's been asking for. All clean, all magnesium powered, all designed around the body you're actually living in. magpieskin.co.uk. Go and have a look. It's great to be able to track your symptoms, actually, isn't it? And I know you mentioned earlier about the hot flush in the night sweats not necessarily being
No.
And it isn't. There are so many. I mean, itchy ears are a massive thing,
Yes.
And itchy skin,
Yes.
but also vertigo.
Yes.
Was a huge thing for me, massive, and just really weird things. And then when you start to talk to other women, they'll be like, "Oh yeah, I get the itchy ears. Is that what it is?"
Yeah.
Because we just perhaps don't talk about ringing in your ears as well.
Yeah, tinnitus,
God, there's loads of things.
Yeah.
And we perhaps don't hear enough about that either, really.
No, you're right. And I think not being aware of those they're not unusual symptoms because they happen all of the time, but not well recognised symptoms. It can then lead to misdiagnosis and then referrals on to secondary care, like to the hospital doctors, to investigate the causes, because often as a GP, you'll try and treat it in the community, but it won't get better because you're not thinking, actually, it might be about hormones. So you might get a woman coming to see you who's had palpitations and been referred to a cardiologist. She's had tinnitus and she's been referred to an ENT doctor. She's had migraine and she's seen a neurologist. And nobody's just joined all the dots up and thought, actually, this is hormones. And if we just replace her hormones, she will feel better and these symptoms will go away. And we had a great speaker at our conference a few weeks ago called Dr. Tash Mirando. I'm going to steal this analogy from her in that she talks about a tree. And if you think about the branches of the tree have all the different symptoms on there, do you want somebody to be treating the branches of the tree, or do you want to think about the trunk and the roots of that tree and think about the underlying cause of all of those symptoms and actually treat that rather than each of the symptoms? And I think that's a really great analogy for patients and for healthcare professionals as well.
Yeah, absolutely. Let's talk about some of the success stories further down the line, because with some of your patients that have come in and have been rock bottom and then have been treated, what's that like when you talk to them 6 months later or 3 months later? Yeah. How are they a different person in front of you?
I mean, it's the most satisfying medicine that I've ever practiced. I think when you're a GP, especially in the NHS, where everything's very time pressured and it's about firefighting rather than any sort of preventative medicine or personalised medicine, you can become quite dissatisfied and downhearted with the way you're managing your patients. It's not how I wanted to practice medicine. And when you have somebody with high blood pressure and you put them on some blood pressure medication and those numbers come down, on the blood pressure machine, that can be quite satisfying for you as a doctor, but the patient's like, well, I didn't feel bad in the first place, and now I've got all of these side effects from the medication you put me on, doctor. That doesn't help me. But with hormone health, it's a completely different ball game, and you can see these massive changes in these women, not just with the symptoms, so you're improving the quality of life, but also looking at their longer term health. So I mean, I've had patients who've slept with piles of pajamas next to them because they've had to change every couple of hours in the night for hot flushes. I've had women who've had really horrible genitourinary syndrome of menopause, which is where you sort of vulval and vaginal area is very sore and irritated and itchy, and that's stopped them from doing the sport that they love. And then we've treated that, and they have just felt so much better and been able to get back to the activity that they love. Women who've been suicidal and then come back to see me, and those thoughts and feelings have completely gone. I mean, I could probably spend all day telling you about the virtues of hormones and the treatments and the different patients, but I think there's an overall theme that the women don't feel heard, and don't feel treated well, and just having some time with them, which is an absolute privilege to have, and to be able to give them the right treatment and to connect all of those dots for them is really satisfying as a doctor. And we get fantastic patient feedback. Our patients come back to see us again and again. The most common way we end up with new patients is because another woman has recommended, which is really unheard of in a company.
It's so true. There's a lady in my gym who used Dr. Louise Newson's clinic to help her. She's in her 60s. She looks phenomenal and she's in incredible shape. And she said to me a few weeks ago, she said, why wait? She's like, I don't get it, because I was saying to her, I've not really sorted anything yet. I've been on this path of just doing it natural. And she said, just don't wait. She said, I wish I hadn't waited as long as I did. Why would you do that to yourself? Yeah. And she was generally sort of perplexed by the fact that, I had that opportunity to sort it, to go, and get looked at properly. And I think that is it, isn't it? When people have been on that journey already and they're like, I wish I'd just done it sooner. Yeah. But it is the word of mouth, because it changes people's lives. And she said that to me. She said, it changed my life completely, and I think that's very powerful. Yeah. I mean, there's the subtle differences as well, but there is a lot of those kind of comments of, I feel back to myself. Yeah. And it's completely changed my life. And one of my sort of favourite populations of patients is the older patients who've maybe been denied HRT because of things like the WHI study, where there was a concern over the risk of breast cancer with HRT. And then these women are learning about menopause and hormones, and they're coming back to see us and say, can I start something now? Like, I'm still having these symptoms and I'm worried about my long-term health. And we can start HRT for them, and it makes a massive difference. So, but I think there's something about being a woman and being able to just do this yourself that stops you from taking that next step. I think there's something about accepting it as well. There is for me. I haven't enjoyed being in my 40s as much as I would like to say I have. I often say that to women, and they'll say, oh, wait till you're 50, you'll love it, it'll be okay. And I think, well, that's a bit of a time away. I want to be happy now. And I feel like for some, and I include myself in this, you just think, oh my God, I'm at that point and I'm not ready to be at that point, and I don't want to be at that point, and I still want to be, what I was when I was 30 or whatever. And it's an acceptance as well. But it can have dangerous consequences. And like you say, you need to take those steps for yourself. We deserve that. We don't deserve to suffer or struggle. Why should we? We know self-care is also a major factor in this, and putting ourselves first and prioritising ourselves. So on a much lighter note, we'd like to ask you for your bath time or shower confession, Dr. Holly. Probably the most taxing question you've had for a while, I'm sure. But are you a bath girl or a shower girl?
So I have a 4-year-old and a 6-year-old, and the ability to have a bath in the evening has disappeared in my house.
You. Yeah.
So we do the bath for the kids, but I'd say probably shower most of the time for me. I do quite like a bath when I'm able to have one. It's about finding that time for yourself, though, isn't it? And I think that's something else that we've not really touched on, is that we're having kids a bit later, so we've got young children, we've got parents who are living longer, who are elderly and they need care. We're working, so we've got all of that responsibility. And then there's everything that you need to do at home, which is a job in itself.
Yeah.
So it is a real juggle. And if you're not feeling well, then that is really hard to keep all of those plates spinning, isn't it?
It is. It's so hard, and you do need that time. When you have a shower, what's it like? Is it a lock the door and, do you sing in the shower? Is there something that you do just for you or take in just with you? Like we have our beautiful Magpie shower gels, which are amazing.
Yeah.
A treat that you have with you in the shower, a confession, or are those kids in and out annoying you at the same time, which is very normal for mums.
I would say that the door definitely gets opened a few times, but it's quite good for the body positivity for the girls as well, because they need to see what a real woman looks like. I think that the thing that I would say is having a little bit of space to think in the shower. Sometimes it's the time when I come up with my best ideas or solve my problems.
Love that.
I just have to remember it by the time I get out to then be able to do something about it. But yeah, I think it's a little bit of headspace.
Yeah. Oh yeah. And we all need that, don't we? It is so busy. What would be the 2 takeaways that you would like our ladies listening today, our audience, to really take away with them?
So I think number 1 would be educate yourself. So use the Balance app, listen to Louise's podcast, look at her website. She has a program called Hormones Unlocked as well, which is a program specifically for patient education. And then use that education to improve your care. So, take that information with you along to your appointments when you see your healthcare practitioner. And I've probably got a few tips that I could give you for healthcare, like having a consultation with a healthcare practitioner if you'd like. And then the second thing is try to educate other people as well. And that might be your healthcare professional.
Yep.
Which, you are very, I've learned so much from my patients. I've learned more from my patients than any medical textbook that I've ever happened to read. So, you could tell them about Newson Education and tell them, go follow us on socials or look at our website and join our mailing list and engage with our education. Because if you don't have a healthcare professional who's well read, then you're not going to get the care that you need. And then if you're able to, come and see us at the clinic in Hale. We're at Bank Medispa in Hale, and we've got some amazing clinicians who work alongside me, and we're really focused on all of hormone health. So we will focus on not only menopause and perimenopause, but premenstrual syndrome and premenstrural dysphoric disorder, which is like PMS on steroids, and also PCOS, endometriosis, postnatal depression. So really like the whole of the lifespan. And we will give you evidence-based, guidelines informed, but, sometimes we have to really individualise our care. And
it's
make
not
sure
a one-size fits all, is it?
Absolutely.
No.
Absolutely.
It's been lovely having you on the podcast.
Thank you.
Thank you so much. And I want to ask as well, obviously, our lovely sponsor, Magpie, and their beautiful magnesium goodies that they have. And they're such an amazing team of ladies, so passionate about wellness. Their bath flakes and their shower gels are beautiful. Is magnesium something that features with you? You know, when we talk about TLC and self-care, and we know it's so good for us. Because actually one of those other symptoms for me is I get terrible, my calves ache.
Yes.
And I don't recover from training at the gym as quickly as I used to anymore either. Another reason why I'm not so happy about being 44. So is a magnesium something that you are a big believer in?
Yeah, I think myself and a lot of the clinicians at Newson recommend magnesium, magnesium glycate usually to help with kind of sleep and mood. We will recommend that orally, but not everybody wants to take an oral preparation, and there might be like excipients that are in that they don't want to use. So, I mean, in terms of using them topically, they can be really good for muscle pains. And I was just talking to the ladies before, had horrendous restless leg when I was pregnant, and the only thing was massage with magnesium creams was the only thing that helped. So I think they definitely have a place to integrate with your hormone treatment to help. Yeah.
Lovely. It's been amazing having you on. Thank you so much for sharing your wisdom with us and for everything you're doing as well. Educating and trying to open those doors and make it easier for women to access care. You're a superstar.
Thank you very much.
Thank you.
Thank you. Thank you for having me.
Thanks for listening. Keep doing you and let Magpie take care of the rest.